Okay, my name is Katie and I'm going to be the nurse doing the assessment today. This is Tori, our patient. So we're going to assume that we did the health history and family history already, and we did the smell and eye chart. So we're going to begin by checking cranial nerve 1, which is smell. So close your eyes, occlude one nostril. What do you smell?
Lotion.
Okay, now the other one. What do you smell?
Candle.
Okay, good. Number 2 is the smell and eye chart, which we assumed we already did. So next we're going to look at movement of the eyes and pearline accommodation. So I'm gonna have you open and close your eyes, checking the eyelids. Looks good. So I'm gonna have you follow my finger with your eyes. Good. Now we're gonna check pearla. Good. Now I'm gonna have you look at my nose, corner of the room, and then back. Okay, good. Okay. So we did cranial nerve 1, 2. We just assessed 3, 4, and 6. So now we're gonna do 5 and 7. So I'm gonna have you puff your cheeks, have you smile, frown. Okay, good. Then I am going to have you close your eyes, and I'm gonna have you tell me if this is dull or sharp.
Dull.
Okay.
Sharp.
Okay, good. All right, now I'm gonna have you wrinkle your forehead. Okay, good. Now we're gonna move on to 8, which is hearing. So I don't have the correct tool, so I'm just gonna have her put her finger to close one of her ears. And I'm gonna whisper in each ear. I'll have you tell me what you hear.
Cat.
Good. Now the other one.
Dog.
Okay, good. So next we're going to move to 9, 10, and 12. So I'm gonna have you stick out your tongue. Good. I'm gonna have you move your tongue around. Good. So I don't have the correct tools to check the gag reflex, but that's when I would do this. I'd have her open her mouth, stick out her tongue, and I'd press the depressor. I'd use the depressor and have you gag. Okay. So I'm also going to have you check your swallowing. Good. Okay. So now I'm gonna have you open your mouth. I'm gonna be checking the teeth, the mucous membranes, the tongue. She doesn't have any tonsils to check, but everything looks good color. Next, we're going to move to 11. So I'm gonna have you do rapid alternating movements with your hands. So this, back and forth. Okay, good. Now fingers to thumb like this. Both hands. Okay, good. Next, I am going to have you let me think about it really quick. Oh, I forgot to have you shrug your shoulders and push against my hands. So maybe do that. Good. Push to the side. Good. Other side. Good. Okay, now we're gonna check graphesthesia and stereognosis. So I'm gonna have you close your eyes. So we're gonna do graphesthesia first. I'm gonna have you put your hand out. I'm gonna draw something on your hand. I'm gonna have you tell me what it is.
Letter O.
Okay, good. Okay, now hold your hand out with your eyes still closed. So stereognosis, I'm gonna have you hold this in your hand and tell me what you feel.
A hair clip.
Okay, good job. So next we're gonna check, we're gonna do Romberg test, check balance. So I'm gonna have you stand up. I don't think you'll be able to see with this. So what I'm gonna have you do is put your opposite heel down near the shin of your other leg. Okay, good. Now the other side. Okay, good. Now I'm gonna have you close your eyes. Put one leg in the air. Good. Now the other one. Good. Okay, now I'm gonna check your gait. So I'm gonna have you walk heel to toe and then toe to heel. And we're gonna be checking for scoliosis as we do that. Looks good. Okay. So I'm gonna be coming, sit back down. So now we're gonna start with our head to toe part. So first I'm gonna check her skin, looking for texture and any redness, swelling, lumps, anything. And then we're gonna move to hair. So I'm gonna check hair distribution. I can palpate for texture of hair, looking at color and all that. So next we're going to move to the ears. So I don't have the correct tools, but we wanna look at the outside, make sure there's no redness or swelling. We would check inside, looking at everything, tympanic membrane, so we would do that to both sides. Looks good. Next, we will move to your nose. So I'm gonna have you tilt your head back a little bit, and I would be looking up. I'd be checking the turbinates. I would be looking for drainage, redness, swelling, anything of that nature. Okay, good. We checked the eyes, so now we will move on to the neck. So first I just want to inspect the neck, make sure we don't see anything abnormal. Then I am going to palpate lymph nodes, and I'm going to feel the thyroid gland. Feels good. And then we're going to listen to the carotid pulse, or feel the carotid pulse on both sides. Good. All right, so next we are going to move down to listening to the lungs. So first, I'm gonna check for mitis. So can you say 99 for me?
99,
Keep saying it.
99, 99, 99.
Okay, good. So now I'm going to listen to all of the fields. For time's sake, I'm gonna go pretty quick. So take some deep breaths for me too while I'm doing this. And then you can also do it to the back. So we're also going to be checking whisper pectriloquy. So I'm going to have you whisper 1, 2, 3. Good. And then I am also going to check bronchophony, listening for consolidation. And then we're also going to do echophony. So I'm going to have you say E.
E,
Keep saying it for me.
E.
So we want to hear the E. If we hear an A, then that is not good. So from there, I think we have checked everything. So we're going to move on to the heart and lungs. So for this, we're going to be inspecting the chest, looking for evenness on both sides. Then we're going to be listening to heart sounds. So we're going to start. So first, I'm going to show you where we're going to be listening. So actually, maybe I'll just do it while we listen. So we'll start with the right side, the aortic. Then we'll move to the pulmonic. Then we will do ERPs, which is second pulmonic. And then we'll do tricuspid. And then mitral. And we want to make sure that we don't hear anything abnormal. And we can also listen for bruits in the neck, using the valve stethoscope. So I don't hear any, which is good. All right, so next we are going to move down to the abdomen. So I'm going to have you lay down. Okay, good. So first I want to inspect the abdomen and make sure that we don't see any lumps or bumps anywhere. So then first I am going to listen before I palpate. So I'm going to be listening to all of the fields, making sure that we hear bell sounds. And I'm just going to go kind of fast. And if we didn't hear them in each quadrant, then we would make sure to listen for 5 minutes. Okay, from there, we want to do light palpation, so just kind of lightly push. We would do that to all of them, and then deep palpation, we would use both, which I'm not going to do on her. And then we would also want to deeply palpate the liver. So deeply palpate liver, and then also feel for the edges of the spleen. All right, so from there, I think I can have you sit back up for me. Keep your legs on the edge of the bed for a second. I'm just gonna check Human sign and make sure we don't have coldness. So at first I'm not gonna have you push, so, okay, and then I'll have you push against, okay, good. And I'm gonna have you put your hands out and I'm gonna have you push against my hand, good. And then push in, okay, and then push out, okay, good. So you can sit back on the edge of the bed. And we already assessed her gait. Everything was normal there. I don't see any swelling in the ankles, which is good. Arm strength is great. So next we're gonna check pulses. So we're gonna do radial. So we can do it on both sides. Have you just relax. Good. Do popliteal. And then dorsalis pedis on her feet, which you can't see. And then we can also check carotid, which we already did. And then I'm gonna check her capillary refill, which is good. And then from there, we're going to do our reflexes. So our deep tendon reflexes, I do not have the hammer. So I'm just gonna kind of explain what I would do. So we have the biceps, triceps, brachioradialis, Achilles, and the patellar. So we would do it, I'm gonna have you relax your arm. Here, inside, put it that way, good. And then here, and then behind the knee, or on the front of the knee, sorry, and then Achilles behind the heel. And everything checked out, you did great, and that is it.